Recording going and start our webinar here for November. For those of you who are new and don't know who I am, I'm Dr. Richard Kim. I'm a regenerative medicine physician and specialist, and this is a webinar based on trying to explain what it is that regenerative medicine is and how best it can help you. A couple of housekeeping things. Number one, make sure that your volume is up. If you cannot see the volume, if you cannot hear me, got to make sure that that volume is up. You should also have a Q&A button. You can certainly use this to ask questions, but if you do ask a question, I will generally answer them at the end once I get through all of my slides. So let's get started here. This is really about how stem cells solve pain. We've got our first Q&A, first question here from a Marilyn A, area code 518. Thank you, Marilyn. She wants relief from constant back pain. So that's exactly what we're here to do today, and that's exactly what we're going to talk about. We're going to talk about exactly what regenerative medicine is and exactly how, for you, Marilyn, yeah, it would relieve that back pain. Noreen C, also from area code 315, asked a similar question. Treatment choices for lower back pain. Low back pain is, again, one of our most common diagnoses that we treat. We're going to explain a couple of the possibilities as to why you have low back pain, but certainly we want you to understand how it is that we treat low back pain. Okay. We all have common goals, don't we? We all want the same things, especially when it comes to the medical industry, when it comes to the medical environment, especially when it comes to pain. We want, number one, to avoid surgery. I think when we think about ourselves, when we think about our parents, and we think about our loved ones, we all want to avoid surgery, of course, unless it's absolutely necessary. And this is something I hear people say all the time. The next thing we want to do is we want to stop medications. I think we're taking too many pills. We're all taking too many pills. Too many pills are being prescribed, and we want to especially stop them for things like pain. Especially knowing things like opiates exist, the opiate crisis exists, dependency on some of these medications exists. We want to try to escape some of this. And the last thing is, of course, quality of life. We want our quality of life to improve after we've gone through this process. We want some insurance or assurance of these common goals. We want somebody with a plan. We want to be talked to like human beings, and we want to be talked to like patients, but we want to hear a plan. In that plan, the things that we want to focus on, and this is me saying we as I too am a patient at times, is that we want something with low risk. We want something with short recovery. We want to avoid any unnecessary pitfalls. I'll give you a couple examples. The first one is a retired psychologist who flew airplanes for a hobby, also a runner, competitive, but also did it for stress relief. The back pain ended the running, no more competition, fun, stress relief. But it also limited his flying time. He would be able to fly for about 45 minutes and then have to take the plane down because that's it. The pain was too much of an issue, and there goes his enjoyment. The next is a chef. This is somebody a bit younger, who really enjoys spending time with his family, his wife and kids. But he's also in constant motion, moving heavy restaurant equipment around all day. It's a pretty physically demanding job. But the pain was now starting to affect his work. It was making the workday difficult. He contemplated changing careers, which is unfortunate. I think a lot of times in traditional medicine, we're really missing the target. And what I mean by that is that we're too quick to push on surgery, and surgery usually means something that's permanent. It's massively invasive. It's huge long recoveries associated. So for a lot of reasons, just incredibly unattractive. Medications, Steroids are known to be a band-aid. They weaken and they damage tissue. But repeat steroids means repeat weakening and repeat damage. Over-the-counter medications can certainly help lessen symptoms, but the effects wear off, which often means that you have to repeat the dose. 2 months after stem cell therapy, this is how our psychologist did. He returned to running. He ran the 4th of July race that we have here in town. It was a 4 mile race. He ran a 13-minute pace, which wasn't his fastest ever, but he was happy to run it. This gave him confidence to train for a half marathon with his grandson. And of course, being able to spend time with his grandson and train for something together with him meant a whole lot to him. The chef, importantly, was back at work, being able to go back full time, no limitations, was able to provide for his family. We really want to break the cycle on this. And the cycle is between pain, degeneration, then recurring back to pain once more. But how exactly do we go about breaking that cycle? We are the third solution, and this is the important slide here. With regenerative medicine, stem cell therapy, platelet-rich plasma therapy, the things that we're using now, we're seeing a high success rate. We're seeing something that will offer you years of relief. So not just the 1 month, 2 month, 3 months of steroids and cortisone, which really never really fix anything. We're talking about something that really has a lasting impact. We're also talking about something with guaranteed acceptance. Since the cells come from you, go back into you, you can't reject it. Here is a graph of how I typically see my patients. The progress is progressive. It is very steady week after week after week. You're going to notice bigger and bigger changes. So what exactly is regenerative medicine? So regenerative medicine, it's a completely new field of medicine. The goal here is to restore and not replace. Restore and not replace. Damaged tissue turns into healthy, functional tissue, and this is what we want. The different materials used to restore this health include two things, typically platelets in the form of platelet-rich plasma, and then also stem cells. The three circles on the right-hand side of the slide here give you an idea of when we think about platelets and when we think about stem cells. So platelets in the green and yellow circle, when the problem is small or small medium, stem cells for when the problem is medium or medium large. Here's a good visual of exactly what happens when stem cells are inserted into somewhere. If you could see the red as the bad and damaged area, the green are the good cells, and you can see the green cells attacking that area. That red represents your pain, your stiffness, your sciatica, the shooting feelings, the aching, the nerve pain type feelings. So if you can imagine putting stem cells in and going in and eliminating this red, then we can help eliminate all those symptoms. My favorite example is the Pac-Man idea. If the pellets that Pac-Man chases and eats are inflammation, platelet-rich plasma would be the equivalent of one Pac-Man on the screen trying to gobble up all the inflammation. Whereas if you put 10 Pac-Mans on the screen at the same time, that's what stem cells are like with multiple Pac-Mans. The goal here isn't really to beat or beat the level and then go on to fight more inflammation. The goal here is to beat and leave the problem behind, beat the game entirely. And what I mean by that is being able to deliver that for 5 to 10 years of relief at a time for somebody. And obviously that's quite meaningful. Where exactly do the stem cells come from? So one of the major sources for us is the posterior of the pelvis here. That spinning image there is your pelvis. And what we do is we extract cells from the center of the bone there, and then we'll inject it back into the areas of the spinal cord, and then into areas like we have there with the degenerative disc. Here's a basic timeline and schedule of somebody who is deciding to undergo therapy with us. So the initial consultation, pretty soon thereafter, we're obtaining an MRI. Soon after that, the first platelet rich plasma injection, then the second platelet-rich plasma injection along with the stem cells, a third platelet-rich plasma somewhere down the line. And then from there, we're resuming activity, physical therapy. We're returning you to chiropractic care. We're starting some exercise. As I tell people all the time, I can inject you for pain, but I can't inject you for strength. That we have to build on our own. But of course, if you're having pain, it's hard to build. So once we can get through and eliminate some of that pain, all of those sort of exercises and movements become more possible. So what exactly can we treat? What parts of the body can we help? So neck and the back are pretty prime targets for us. When you hear things like stenosis, arthritis, degenerative disc disease, sciatica, you want to start thinking about stem cells and treatment along some of these areas. Lower body, certainly arthritis of the hips and knees, bursitis, meniscus damage, Achilles tendon issues. Upper body, similarly, rotator cuff, which are tendon tears, arthritis of the shoulder, tennis elbow, carpal tunnel. A lot of people want to know, am I a candidate? Is this therapy that you're talking about, Dr. Kim, is that right for me? And what I would say to you is that anywhere that is injectable or even operable, if somebody can offer you a surgery for that area or offer you an injection for that area, you can equally have stem cell therapy of that area. What's important for us is obviously the diagnosis, and having an accurate diagnosis for us is everything, because once we have an accurate diagnosis, that means not only can we get the accurate location, but if an accurate location and accurate therapy, then you're getting accurate results. For us, having our own MRI and being able to offer you an MRI as part of this entire process is critical for us. Your location of therapies a lot of times will be based on that MRI. Not so much the diagnosis always, but at least the location. What if you've had surgery? Absolutely, yes. So what I what we typically want is for you to undergo a consultation with us and meet us and understand the process and understand, well, how is the surgery that I've had before going to impact or change this ability for stem cells in the future or at present. For us, again, it's important to start off with that diagnosis, even if you've had surgery. We want to get some imaging. We're always interested in the history and exam. We want to know the type of surgery you've had, whether it was arthroscopy, if it was a fusion of the spine, rotator cuff surgery. These details are important. Frequently asked questions are, where will my stem cells come from? And so you saw in the spinning pelvis there, the bone material there is a rich source of stem cells. In some people, especially in joints, we're also taking stem cells from your fat or adipose tissue. The next question of how long before I can become active. So typically when we hit that third platelet-rich plasma, that's when we're reintroducing not only physical therapy, but activity. When do you feel the benefits? People feel benefits pretty early. I'd say within the time frame between the second and the third injection. That's a pretty key time where the beginnings of that curve begin for a lot of people, feeling better week after week, making progress week after week. Next question of how long will the tissue stay repaired? And that, again, really between that anywhere from 5 to 10 year. So it does depend on what you're treating and how long the longevity of some of these therapies will last. Having done this for 10 years, I can certainly tell you, yes, exactly. For a knee and a hip, it's going to last exactly this long. For the neck and for the low back, certain things will last, a certain time frame as well. Everybody wants to know, well, how well does this work? And this works incredibly well. I will say that there are a couple of factors involved. The individual matters. Sometimes the extent of damage you've had matters. Whether or not you've had surgery matters. That's not to say that we can't help you, but we can still make improvements. But certainly, a lot of these factors will affect the ultimate outcome, and so it is very individual specific. By the time you get through the consultation, I will tell you exactly what it is, my experience is for exactly somebody like you, and give you an idea of success rates then. Carolyn, so we'll move on to some Q&A here. So Carolyn A from area code 514 asks, treatments for degenerative disc disease and spinal arthritis, cost of the treatments and healthcare coverage for Canadians. So this is one of my favorite questions. So for us, degenerative disc disease is best described as a jelly donut. And for you in Canada, for those Tim Horton donuts. But if you looked at it as jelly leaving the donut as degenerative disc disease, that's really where we're getting a lot of this irritation of not just the disc space, but also of the nerve there. So you could see in that big circle that's now enlarged, that blue material, which is where the disc is, how close in proximity it is to the nerves. And so when there is irritation, when there is jelly leaving the donut, the nerve then becomes irritated. So stem cells really means for us keeping jelly within the donut versus something like surgery where they may just cut out the jelly, but it has not changed the quality of the donut. So I'm going to say that again. So stem cells means changing the quality of the donut, whereas something like surgery means cutting out just the jelly, leaving the donut the way it is, and not changing it. So there's some clear differences, right, between what we do and what surgery does. For you Canadians, a lot of you, you who have access to RAMQ and your government payer system, we do not participate with any Canadian payer systems. However, we do offer Medicard. So Medicard for Canadians, it's a 0% interest or financeable type system for a lot of procedures up there. We have enrolled in their program, and they have certain terms, I believe, that they extend to Canadians. So certainly that's something you can find at medicard.com, and you can search for our practice, and we are within there. Next question of Carly S., area code 603, non-invasive back pain treatment options. So we've been talking about it this whole time here, Carly. We were talking about utilizing cells that come from bone and inserting them into degenerated areas, specifically for back pain and for degenerative disc, and injecting that into the jelly donut. So it's important for you to know that, some of these therapies that we do, we're talking about relief that can last 6 to 10 years. And of course, the important note on that is that they're repeatable. For us, this is an in-office, it's non-surgical, very much non-invasive or minimally invasive. We're talking about no use of hospitals, no general anesthesias. You come to the office, have it done in the office, you walk in, you walk out. Our program or protocol, however you want to describe it, is a series of injections. So it's really no more than that. It's no more than done with needles. Obviously, there's a certain amount of information that needs to happen in order to make this all work well. But nonetheless, it's simply boiled down to a series of injections. It's important for you to know that even if or you or others, even if you've had decades of pain, these kinds of therapies are incredibly helpful. So Alan A from area code 845 asked about the efficacy of stem cell therapy using bone marrow source instead of placental stem cells. Great, one of our favorite questions. Thank you, Alan, for asking. So we're going to start off with a couple of important words here. Number one, autologous versus allograft. So if the cells come from you and they go back into you, we're talking about autologous. If we're talking about cells that come from somebody else into you, we call that an allograft. Currently, as of today, November 20th, The United States has no FDA-approved legal allograft for these orthopedic type indications. Now, the rules in foreign countries are completely different, but you're expecting their FDA to be on the up and up and provide the kind of guidance that keeps their population safe. For us here, there currently isn't. Now, if somebody does offer you a placental product, those do exist, but they're typically nothing more than proteins, and there is no cellular material. Even though they may quote studies and show you graphs and show you several other things, there is no viable placental stem cell product here in the United States. Okay, so it's a good question. Michael H. from area code 619 says solution for severe stenosis with sciatic radiculopathy, looking for alternative to two-level spine fusion to L405 and L5S1. Epidural injections not effective, using too many opioids, still not full relief. Clinical notes going back to MRI of March 2023. Michael, I think you're honestly one of the more ideal candidates that walk into our office in this exact situation and scenario. If you undergo a fusion, you are at risk for something called adjacent segmental disease. And what I mean by that is that if you undergo a fusion, you're going to put yourself at risk for permanent loss of flexion. That means the disc both above and below have to increase their flexibility to compensate for the level that you've fused and lost. This really speeds up the degeneration of those discs. And this is why you hear somebody who's undergone spine surgery several years later or even months later have to undergo another surgery. And then it just seems like this constant, unending cycle between surgery, recurring pain, surgery, recurring pain. And obviously, when you get to a certain point, you've fused everything, you've lost all flexion, you've lost all mobility, and a lot of those people still continue to have pain. So obviously, some things to consider when talking about something like fusion. Steroids, we know, really feel like band-aids, and unfortunately, over time, become less and less effective. And lastly, the opioids. They really, and a lot of times, create more problems than they do solutions. And of course, we're willing to trade off a few hours of relief, but sometimes the thing that's sort of compounding is not just simple things like constipation, but dependency and withdrawal symptoms and all of this. So it sounds like for you, Mike, you've got a pretty complicated case. I would strongly urge you to have a consultation with us. I think an exam would be important. I think an MRI with us would be probably part of that process in getting you back going again. But yeah, I would say that you sound like a pretty ideal candidate here. Monica W from area code 518 said how safe and effective this method is, and I'm assuming you're talking about stem cells. And I will tell you that minimally invasive also means minimal risk. So when you undergo surgery, you're undergoing long cuts for which you have to undergo general anesthesia. So all of these interventions, all of these things being done to you, the more involved, the longer, the more heavy sedation, the risk changes, the risk increases. With minimally invasive, that means you have a lesser chance of injury to nerve, artery, vein, muscle, bone, tendon. Obviously, this is something I say pretty often. But if you're only working with a tiny needle, a tiny thin needle, the injury to possibly some of these things goes down, as well as the chance of infection. If you're not making large cuts in order to perform operations, you're not putting in hardware that can get infected, you're considerably at lower risk. The effectiveness, we've had patients undergo some of these therapies and last as long as 10 years. And and I check on them yearly. And come January 1st, I'm going to start saying 11 years, which is a real nice thing to be able to say for somebody's pain. Judy N from area code 438 asks cartilage replacement therapies, Neovisc injections, cost of treatments, and thank you. Thank you, Judy, for asking the questions. So it sounds like if you're talking about cartilage, you're talking about osteoarthritis, which for us is a fairly common diagnosis, if not the most common diagnosis that we see in both knees, hips, shoulders, ankles, large joints. What we do really changes how arthritis affects your knees. What we are not doing is we are not growing new cartilage. And the point on this is that you don't need to. And I know that may be kind of a head scratcher for you, but and for some people listening, but it's a very powerful therapy that helps regenerate the environment and how arthritis affects your pain. And not and without ever having to necessarily grow cartilage. During a consultation, we can explore that further. Some of the important points here is that it is for especially knees, you can get 5 to 7 years of pain relief, but of course, these are repeatable. Everything that we do, again, all in office, no hospital, no anesthesia, and with excellent, I forgot a T there, excellent results that we've happily done thousands over the last 10 years. Costs, a little bit difficult to say without ever having met you, Judy. We'll certainly need to examine you, any x-rays, MRIs that you may have that might help us to understand the level of disease you have, and the level extent of damage would be helpful. James C. asked from area code 518, what results can I expect? Again, results are very, very individual, per person, different. What I will tell you, the factors that do affect the results are, number one, if you've had prior surgery. Number two, if you've had conditions, what sort of medical conditions do you have? Do you have MS on top of that? Do you have Parkinson's on top of that? These sort of things we want to know. How much steroid have you used in the past? When was your most recent steroid use? These are definitely things that can certainly affect the outcomes. And for us, I'd probably say one of the more important things is the overall fitness. Are you an active individual? Are you an active person? Not to say that those who aren't active won't get benefit, but these are some of the things that I think not only do we want to know, but help influence our understanding of how well you're going to do. What's interesting is that in the many years that we've done this, is that the factor that does not affect the results is age, and we've had many, many people as far as the age of in their 90s do this and do well. So just to give you an idea that you shouldn't disqualify yourself or count yourself out because of age. Christine P. from area code 518 said, will this help my spinal stenosis? So stenosis is for us a very common problem that we help. This tunnel picture in the background, I put that there intentionally. That usually is a sign that the disc is being held. So the tunnel in the spine is being held open with your disc, and so it's propping the tunnel open. A degenerating disc means that that tunnel is then shrinking, so no longer are you being propped open and you're getting shorter and shorter. The regenerating the disc means helping keep that tunnel open, and then therefore keeping that tunnel open for the nerve to pass through. For us, it's important. We have an in-house MRI. We have this as just part of our procedure. Having accuracy is important. Understanding the locations is important. Certainly for those doing MRIs in other places, please be careful. Just fee versus insurance. A practice should not charge you an MRI fee if they're also taking insurance, and that can also be considered fraud. So something we unfortunately have to see and deal with every once in a while. For William B., Area code 404 wants to know about knee repair, not replacement. Yes, absolutely. We have repaired thousands of knees. We've probably done the most in upstate New York here. Stem cell therapies and joints for us include not just knee repair, but hips, again, neck, low back. We've done this for 10 years, so quite a bit of experience. We're the first stem cell practice in upstate New York. We've done the most number of knees by far and around. Our process versus others is significantly different. The continuing education that I myself have undergone, the continuing education I provide for my staff. This is essentially all we do. We are a solely regenerative medicine practice, and so we're pretty dedicated to this. And the one thing that you want to walk away from this is that it's not just a single injection, and it's more than just that to have stem cells or even platelets be successful. Catherine A asks from area code 917, I've got degenerative arthritis in my lumbar spine with a forward protrusion of one vertebrae, comma back, and arthritis in my neck and knee. That's chronic. I especially would like back relief. So, Catherine, if my understanding is correct, what you have is something called spondylolisthesis, and it's a very frequently thing that we treat because spondylolisthesis contributes to your degenerative disc, contributes to your stenosis, contributes to your pain and arthritis. And that really means just like the blocks that I've put into the background here, where one is slipping in front of the other and then pinching off certain areas. In fact, the youngest patient that we've ever treated stem cells with in my office was 17, had this very problem. So it's not just a problem that comes with quote unquote age, but it is something that can be developmental. People quite young can develop this with pretty severe consequences, obviously. So for degenerative disc and sorry, for degenerative arthritis, not just degenerative disc, but arthritis and things like stenosis, we are one of the, or I should say, I am one of the few physicians who can do degenerative disc of the neck. So certainly, if you have neck issues as well, certainly something to think about. Again, just to reiterate, our experiences are quite extensive and goes back a full decade here. All right, so that's the end of the Q&A questions. For anybody who is made it through and watched the entirety of this, I'd like to extend to you a free consultation. The catch is that you have to call this Friday, the 22nd, today's the 22nd by noon, and the office closes at noon. You have to mention webinars in your phone call, and of course, schedule that consultation. Our phone number here is 518-871-9900. And for those of you who are north of us in Quebec, our phone number there is 514-697-8919. You can find us at richardkimmedicine.com. Plenty of resources there to learn more about what we do and how we do it, and about myself and our practice and the members of our practice. You can go to /webinars to watch any prior webinars, and you can also use that to watch any future webinars. /MRI is another option for those who are looking to have that MRI scheduled on your own. Just have to submit the inquiry there. Okay, so I am going to unshare the screen. And let's see. All right. And we are there. Okay, so I'm going to get to some Q&As that are in here. So we've got a first question from Larry Boyer. Why not use blood cord stem cells. I am 74, so how good could my stem cells be? So great question. So this goes to that whole autologous and allograft conversation, Larry. And the question then there is, can you get cells from somebody else to you? And I will tell you that there's no FDA approved process for that, especially for things like knee pain and back pain. So there's one limitation there. Number one. Number two, you'd be surprised. At 74, you're quite young in our practice. We found that people with even 74 years old and older have excellent quality stem cells. Now, provided, given the age, in some instances, we have had to take, and certain conditions, we have had to take, say, more sampling. We've had to take more of your bone marrow or more of your fat in order to achieve the type of quality, number quality stem cells for your back pain, for your knee pain, for your hip arthritis. So there is some subtle changes to the technique, but overall, believe it or not, at the age of 74, your stem cells could be quite well. You also said define success with stem cells. Will I be able to go back to cycling, gardening, and hiking and snowshoeing? So that's a great question. So if you've never done those things before, will you necessarily be able to do all those things? That might be a tough challenge. If this is something you've been doing and just recently stopped, for things like cycling, gardening, hiking, and snowshoeing, these are all what I would consider, an active lifestyle, activities that we've certainly gotten people back to. I don't think that those are massive challenges. If you said, look, once I did stem cells, can I finally run my first marathon? I might say, okay, that's probably a little bigger task to ask for out of these stem cells. But from what you're asking, cycling, gardening, hiking and snowshoeing, minus the hiking and snowshoeing, cycling and gardening are essentially non-impact, and hiking and snowshoeing, pretty soft surfaces and pretty gentle to begin with. So I would probably say, yeah, those are very reasonable goals. And I agree with you. I would say that if we could get you to that, we'd achieve a success. But I'd also have to know exactly what your current physical state, what your current physical conditioning is like. So that's important. But we'll probably have to get through a consultation to know. Marilyn said, I had bladder biopsies on November 7th, see my doctor Friday. Already know the results are cancer. I'm sorry to hear that, Marilyn. Including my kidneys, I believe. I have seen results, but not seen doctor yet. By having cancer, will that have a bad effect on this treatment? So that's a great question. So we have had patients who have previously had cancer or currently are undergoing treatment for cancer. For us, we certainly want you to be not necessarily cancer free, but in a state where either the chemotherapies or the cancer itself isn't going to be affecting our process. So the type of cancer matters, where you are in the treatment cycle matters. So for you, Marilyn, what I'd say is that I'd probably want to talk to your either urologist or your oncologist and have that sort of doctor to doctor conversation, and so that I can explain what exactly it is that I'm doing, and then they can also weigh in on what sort of risks may be involved. So that's a great question, and hopefully we'll be able to help you. Larry again asked, how much pain is experienced in the procedure? So surprisingly, not much. We sedate you, we give you medications beforehand. There is a quite a bit of local anesthetic that is used. We just did one today of the spine, and the patient slept through half of it. So gives you an idea exactly the kind of comfort that we're looking to achieve, and can achieve. We play nice music in the background, and in the thousands of these that I've done, I've never had to stop one because of pain. You will feel a little bit of a pressure type sensation, but again, very, very well tolerated. Sarah said, if undifferentiated stem cells can regenerate tissue in degenerative disc disease, Why can't they regenerate cartilage? Great question. Um, so when we originally started doing stem cells for things like knee pain, the initial thought was just like yours. We can regenerate cartilage, we just have to put the stem cells there. What we found in those early studies was that you could put the stem cells there and the patient will have this dramatic reduction of pain. But when you go back to look at their knee, both either under surgery or through MRI, there was no change in the cartilage. So that really was a head scratcher for a lot of us, and we said, well, how does that even make any sense? So really the long and the short answer to that is that loss of cartilage or arthritis creates a painful environment, and the stem cells regenerate that painful environment. The other way you can say that is, well, I need cartilage, but if you were to say, well, what does your cartilage pain feel like? You wouldn't know because there's no nerve receptors in cartilage. It is the loss of cartilage that is then creating this painful environment. Once the stem cells get into that knee, it shuts down that painful environment, but that area of lost cartilage continues to remain. I hope that makes sense. If you took 100 people without any knee pain across all ages, you're going to find a certain percentage that have little to no cartilage or a fair number with a decent amount of cartilage loss. And those people do not complain of knee pain. Why? Right? If all cartilage loss is supposed to create pain. And for whatever reason, some people in that cartilage loss can create knee pain, and then there are those who do not at all. If we can get you to a cartilage lost, so you present as a cartilage lost state, but through this process, you have no knee pain afterwards. Do you care how much cartilage you have? I guess that's the other way that I often like to phrase my questions to people. And of course, people want to just be pain free and they want to get on with their lives. I think. Oh, Sarah asked another question here. Yes, but if it's just relief, then why not just do the rooster comb or hyaluronic acid? Great question. Because they don't work. I should say they don't, it's not that they don't work, they don't work well. So studies have been done, and if in mild level of osteoarthritis, you use that rooster comb or hyaluronic acid, about 60% of the time it works. It's not great numbers. So there's obviously more to it. And by the way, the whole idea of the hyaluronic acid is it's nothing chemical. It's physical. What you're trying to do with the hyaluronic acid is increase the thickness of the viscosity of the fluid in the knee. Basically, you're saying that it better lubricates with oil than you do water, right? Which, sure, we understand. But the fact that it doesn't cure all your pain says that it's more to it than that. There's more to it than that. So when they did this study with injecting stem cells and found people's knee pain to reduce, but no more cartilage growth, I think that's really where we started to ask a lot more questions. What we do understand now is that by the types of stem cell process that I do in my office, we're able to dramatically reduce pain, keep people from knee replacement, back to running, hiking, cycling, quality of life. Um, Even without that cartilage growth. And I hope that makes sense. And I wish that it did grow cartilage. I wish that was perfect. But that currently is the limitation of where we are. And part of that has to do with, I think, the FDA. Part of that has to do with, our current knowledge base, our current understanding of what really happens inside of a knee joint, inside of a hip joint, inside of a disc. You can't inject somebody, have them get better, and then splay them open and then understand all of these parts. Sometimes it does take, um, it's a lot of inference and just trying to understand that patients are better. So hopefully that's helped. All right, I'm going to cut out of the screen here for just a second, so I'll give anybody a chance to ask questions if you've got some. Sorry, my son is here for a ride. Okay, so I don't see any more questions at the moment. These are all really good questions, by the way. You guys have done an excellent job. Okay, give a few more minutes for any other, or a few more seconds here, I should say, for any more questions. All right, you guys, I'm gonna say that that's. Oh, Marilyn, you have done an excellent job on how you have helped so many people. Thank you, Marilyn. I appreciate that. And I hope that some information here was helpful for you, and I hope that we can help you with your pain ultimately. Have a good evening, you guys.